Better in Basetlaw Place plan describes what the partners want to achieve together and how we're going to do it. So how are we going to enable community-based wellbeing support for Basetlaw people? Making sure that we're getting the right support at the right time when people become unwell. Looking at our transport system and offer sustainable and effective services with our workforce, IT and digital and estates being critical to all of this.
Health and people's well-being is very important in this part of the world, and if you look at the work that's been done with the District Council, the County Council and the CCG, we're coming up with some really very good ideas with perhaps not too much amount of resource, which I think is starting to provide some real benefits for local people.
It's those little things that we do at the local level that make such a difference, and that's what I see we can develop through the Integrated Care Partnership, bringing in the other partners who we're now working with as well, and make a real difference for people.
We know that we have to work together with a wider group of stakeholders, the community voluntary sector, the council and so on. And the reason why that's so important is that what keeps people healthy is more than just the treatment that we offer in the health service. So that stakeholder engagements with all of these partners is absolutely essential for the health and well-being of the population of Basetlaw.
We're using technology to assist developments across Basetlaw, and using that technology it's allowing different services and different health professionals to see and share information which will help them when they're working with patients and in communities. So we're not duplicating work, we're not duplicating information, so this would save time for the person in order so they're not regurgitating their information twice or 3 times to different health professionals.
One of the most important things we need to do throughout this transformation is ensure that what changes we're making are the right changes. In order to do that, we are ensuring that we collaborate with the community of Basetlaw, the patients of Basetlaw throughout the whole process. We've arranged various stakeholder events and engagement events, listening events, and we'll continue to keep readdressing what we're doing throughout the transformation, making sure we get things right.
Which is why we're into population health management. So actually working out what are the big impacts on our patients' health and how we can work collectively together to actually target particularly the hard to reach patients and actually try and get their outcomes to be as good as possible.
We know that Basetlaw has a number of priorities, one being that Basetlaw residents are heavier and there is more obesity within Basetlaw. We also know that there is a higher level of smoking within Basetlaw. So they are 2 points that we need to address in order to improve the health and well-being of residents in Basetlaw in the short and long term. So the health of Basetlaw residents can be improved through using the Health in All Policies approach, because this allows us to look at the wider determinants of health and bring health into non-health settings and also consider health in all of the policies across Basetlaw.